Welcome. In this session we'll talk about the admission status order. The admission status order is needed every time a patient is placed into the hospital. And that order can be placed from as a single order or as part of a power plan. And that order has components that are important to know about. The admission status order is really a determination made by the provider, the attending provider, of the level of care of a patient. And so it is important to answer all the questions needed so that the level of care is appropriately documented. This is required for all patients, once again, coming into the hospital. And so to find the admission status order, I'm going to demonstrate how to just place the order as a single order. So here I have a fake patient loaded, and here I can go and search for orders here. So if I click Add, a search box opens where I type the words admission status. And if you note, the admission status order is here. You left click on it once and these order sentence windows open, which give you kind of like the glimpse of all the details that need to be filled in. And so we recommend to pick one of the levels of care here. And how would you know that? And I'll go through that right now. So that you would never select the none option, because that is the hardest way of ordering this order. And so the first option is called admit to inpatient. Second one is observation. Third one is AM surge, extended ambulatory surgery. T means today, N means now. ALC is alternate level of care. Admit to non-acute inpatient and respite hospice. These are our options for using for admission level of care. So let's say we wanted to put the patient under observation. Okay, and notice how it says 24-hour, and you'll see in the next screen why these are present, because they populate certain fields. And if you hover over, of course, you can read everything about this as well. So if you click OK, it'll accept those data fields. Click Done to close your search box, and notice how the admission status order is clearly displayed here. The order details window is showing that the expected length of stay for an observation case is 24 hours, that the status is determined to be observation, and then there is a reason to support this decision, and we've pre-populated this box. However, one can simply correct here, highlight this with the left mouse button, and then simply type whatever they wanted. But here we've pre-populated the presentation pattern is consistent with low risk for complications and the patients being monitored for certain conditions. And so that is okay if you like it. You can simply add to it if you want. Then there's a certification statement that is there that is needed for Medicare, that I certify that the level of care is their hospital services are outlined and they're in compliance with the Two-Midnight benchmark. And then the expected post-discharge plans are here. So here you could type in, let's say for instance, home. That you don't have to have the exact post-discharge plans, but a guesstimate of what the post-discharge plans might be. And then the next one, it says here diagnoses. So there's a blue colored. So once we enter the home into this field, these yellow fields are mandatory. This blue icon here goes away. And so notice how the blue icon went away, and I clicked on the tab left clicked on it, it's calling it diagnoses. Now here someone has entered in sepsis in this case, but maybe that's the reason that they're here, or maybe they're not, in which case you could simply left click here and select sepsis, and notice the diagnosis is sepsis that you've selected, and the blue icon has gone away. Or one can unselect the sepsis and click add and simply add in a diagnosis. And maybe I want here under my favorites, this is the diagnosis window that opened, and I can go either click here and search for a UTI, and click search and pick acute UTI, or I can select it from here where my favorites are. So in another session we will show you how you create favorites. And so if you click OK, notice UTI has been added, and click OK, and notice how UTI now is selected. So to review, the admission status requires several fields to be filled out: the level of care, the reason to support that level of care, the expected length of stay, the expected post-discharge plans, and a diagnosis. Satisfying all this data helps the patient get into the correct level and improve our documentation with respect to this order. So if you click sign at the end, now you've placed this order called admission status. Okay, and so what I will do is show you that was the way that process was for ordering that order singly by itself. However, you'll frequently find that power plans have this order in it, and I will show you how to use the order from within a power plan. If you were to click add and go into this power plans folder and perhaps go to this admission med-surg folder, this power plan, this blue yellow colored icons. So you left click on it once, click done, and notice how this power plan loads, and notice the same this order is in this power plan, and so many power plans have this order. So in order to manipulate this order, you would first left click on it in this white spot, make sure it's highlighted blue, make sure it's actually selected, then right click and modify. And notice it's the same screen that comes up. So here you could select let's say ambulatory surgery and click OK. So notice how ambulatory surgery populated here, and it says here the patient's level of care is for further monitoring and stabilization for routine recovery from anesthesia, etc. So that's the reason, and then they're supposed to stay here for less than 2 midnights, and the expected post-discharge plans are to home, and then diagnosis is acute UTI. So notice how we've satisfied, and I toggle the details window with this black arrow, and notice how this order now is fully satisfied all the fields. And so now that we've figured out how to manipulate the order from within a power plan, and also place this order from within singly, just simply by clicking add and then searching, for that order, I would like to make a couple of points very clear to describe the levels of care. Whenever a patient comes into the hospital, this order needs to be placed first. If the level of care changes, let's say the patient goes from an ambulatory surgery status to an extended ambulatory surgery status or inpatient status, the order to use would be the status change order. Okay, that status change order will populate and open up, and you would then select the new level of care. So let's say they were on extended AMSurg and they went to inpatient, you would select this inpatient option. You would not want to discontinue or cancel reorder the admission status order. That order is a one-time stamped into the chart saying the initial level of care was this, and then subsequent levels of care that change from inpatient, OBS, AMSurg, extended, ALC, you would be using the status change order to subsequently change the level of care. So that's the order to use to change the level of care after one admission status order has been placed. Next, I'm going to talk about the different levels of care themselves to give a little bit of education on what these are. So the first one is inpatient. Okay, and I'm going to load this plan just so you can see. If you load up the admission status order or the status change order, and you select, notice how the presentation pattern is now, it's saying the severity meets inpatient level of care. If you were to then drag this down and go to observation, notice this sentence still says it's for inpatient. And so you would not want to use this drop down to change levels of care, because the reason to support inpatient observation field doesn't update based off of what has been selected here, like hospice. Here it still says the patient requires inpatient level of care. So you wouldn't want to necessarily change the level of care from this drop down field. What you would want to do is right click and remove, or perhaps add a new status change order, where you would get those order sentences. You would want to order it off of those order sentences. So these are the order sentences that I'm referring to. So let's say you change your mind, you wanted to do ALC. So you just simply select the choices from here because all the order sentences are correct. The details are correct of the order sentence. So here, you would say for ALC, you would say going to nursing home. Okay. And an expected level of care. And you would say expected post-discharge plans would be nursing home. So, so that's how that would work. Now, I just wanted to describe, so inpatients are those that are going to require 2 more midnights. Observation cases are those that are going to be here for 24 hours, after which a repeat determination needs to be made, an exam and a note determining either they're going to go home or they're going to stay here as an inpatient, because their observation time is limited to 24 hours. So in order of severity of service and intensity of service, severity of illness, inpatient is the sickest patient. Observation is then the one less, a little bit healthier. AMSURG cases are considered outpatient, and they're supposed to be discharged within the same day. And so those are routine surgical outpatient cases. An extended AMSURG case is where extended monitoring is required. No complications have occurred. They're simply recovering from the effects of anesthesia or pain, and a safe discharge plan has not been made. So extended AMSURG is the level of care of choice. They stay overnight for monitoring. Now, ALC, alternative level of care, are those patients that were inpatient or observation or directly went from the ED to the ALC floor, where it's basically they're waiting for a disposition to a nursing home or a rehab or a healthcare facility, where they're awaiting a bed essentially. The respite hospice option is pretty self-explanatory. They're here for hospice and respite care. The non-acute care setting, these are quote-unquote social admissions. They're not inpatient, they're not observation. They're simply unable to be managed in another setting, and therefore there's no other setting to bring them to. And so that is called the social quote-unquote admission that doesn't qualify. There's nothing medically wrong. They're simply needing extensive services outside of the hospital that they're not able to get. And that's the non-acute care setting, level of care setting. So with that, I would like to end this session. Thank you.